Thank you, everybody, for joining us today. It's going to be a very interesting webinar today. We're going to speak about how online estimates can make the difference in your conversion rates. And it's really going to be a combination of two different things. One is going to be a great software from one side that actually give you the ability to provide pricing on the website. And the second side of it is going to be the discussion about giving prices on the website. There is big discussion about it all the time, especially in our industry, whether you should or should not expose your pricing before you see the patient and before you get the chance to interact with them. And we're going to cover a lot of those concerns. I'm really honored today to be joined with Dr. Jonathan Kaplan. I'm Isaac Musli. I'm the CRO in Symplast. I have very extensive knowledge in softwares. I even developed myself lead management solutions that was acquired by Symplast. And we're also going to review that today, Medical PRM. Jonathan Kaplan is a board certified plastic surgeon based in San Francisco. Actually, funny fact that I believe most of you do not know is that Dr. Kaplan and Dr. Kasuma, founder of Symplast, trained together in a Cleveland clinic. That's a funny fact. I guess they also taught you how to be an entrepreneur in addition to be a doctor. And without any further ado, I'm going to pass it to you, Dr. Kaplan, so you can start to introduce the agenda for today.
Great. Well, thank you so much. I appreciate the introduction. Yeah, we're going to be talking about a lot today. We're going to be talking about some of the dogma, the expectations of why you can't share pricing online. It's something that I've learned as I moved here from Louisiana to San Francisco. I realized that online estimates was one of the things that really separated my practice. So I kind of got past that dogma of why you can't really share pricing. We're going to talk about why healthcare providers have always been concerned about sharing pricing, and then talk about the benefits of sharing pricing and how we do that, how we generate leads in the process, review some of the data about online pricing and how it does help with conversions. And then we'll talk about the integration with Symplast that we are now doing between BuildMyBod-Health and Symplast Medical PRM. So let's start with the dogma. So when I would say dogma, I'm talking about these are the things that we just always were told to believe, or we used to believe. We just knew for sure they were factual things. And one of those is that we always were told that a healthy diet it should include a big breakfast of bread and cereal, and at some point through the day you should have some pasta. That this was what we were always told. We knew this for a fact, that the food pyramid from 1992 said a healthy diet would include all of these things. And of course now that's not true anymore at all. In fact, they're saying that maybe breakfast is not the most important meal of the day. Maybe you don't even have to have breakfast. Maybe you should just do intermittent fasting and have one meal a day. But we were told that was absolutely the truth. Then at some point, there was the dogma that electric cars would never totally replace a gas-powered automobile. And here we are, 2035, California is not going to even allow you to sell a gas-powered automobile. You'll have to use electric by 2035. And then finally, of course, we used to believe that there was no way you could put pricing on your website. It was just too difficult to share that pricing with the consumer. And here we are now, January 1st of 2021, the federal government is saying that hospitals have to share pricing through a price estimator, similar to what you're seeing on your screen. And that it doesn't matter whether you think it's too difficult to do it or not. The federal government says hospitals have to do it. And even though that's not required of doctors and surgery centers, that is going to trickle down. The consumer is going to expect that. And there is definitely pushback. Hospitals, this is an article I wrote about 10 ways that hospitals are non-compliant with that January 1st rule that requires them to put pricing on their website. And even though they are non-compliant, it's going to get there. Again, as I said, consumers are going to expect that from everybody, including doctors like us. So why are healthcare providers so concerned about posting their pricing online? Well, they have some legitimate concerns. They're worried that the patients might price shop instead of focusing on the doctor-patient relationship, or that the patient might not understand the prices or estimates subject to adjustment, and I do get that, and that they're worried that the competitors could be comparing their pricing. Well, what I want to say to that third point is that they're already comparing your pricing. They're calling your office staff, wasting their time, acting like secret shoppers, asking about the price of different services. So they're already doing that. So whether you post prices online, they are already doing that. And my argument to you would be, well, if you post them online in the right sort of way, that you might save your front office staff a lot of time wasted with those callers.
Dr. Kaplan, before we go to the next subject, I have a question on this one, because I think it's a very interesting topic, and right away, probably people have it in the back of their head. So normally when they call to the practice front desk, or even if they get all the way to the patient coordinator, depends how much time they spend to the practice, going to give them a range of price, right? From, I guess, minimum to kind of like the ideal where the practice would like to collect. And then based on the skin type and questions or things that they can get through the consult room, they can really fit the right price. So how would Estimate will do that on a website?
So yeah, I know a lot of people like the idea of doing a range, and let's just use a quick example. So how can you say a price for a breast augmentation? Because it could be breast aug with saline, breast aug with silicone, breast aug with a lift. And my argument to you would be, if you provide a range, that's really confusing to the patient, because you could say a range of 5,000 to 15,000. It's not very helpful. So what I would say is that on your website, as I'm going to demonstrate in a little bit, that just stratify that. Rather than doing a range, show the range of procedures rather than the range of price. And what I mean by that is show the price for a breast aug with saline, show the price for a breast aug with silicone, and show the price for a breast aug with silicone with a lift. And then once you get their contact information, which is the big thing that we provide, is the contact information for the patient, that your office staff then calls them, follows up with them, and then gets a little bit more information so that we can ensure that by the time they do come in for a consult, you've got a pretty good idea of what procedure they're interested in and which procedure they're a candidate for. So that's kind of how we use estimates, is to just a starting off point of a conversation, getting their contact information, and then you can help make sure they're making the right decision. Because you obviously don't want to give the price for a rhinoplasty when you find out it's been their 15th revision. And that's exactly the point. Exactly right. And so that's the benefits of providing estimates online, is that you provide the consumer with the information they're desperately seeking while improving the front office processes, just as I demonstrated, as I explained. And then also, this is something I want to dive a little bit more into, is it's a major improvement in your SEO and your search engine optimization. Let me give you an example with my website. We found with the use of Google Analytics, we found that patients that came, or consumers that came to our website before we had a price estimator on our website and after we had pricing available on our website. And we found that they were twice as likely to stay and browse the site. So the bounce rate, meaning how quickly they left, the bounce rate dropped from 61% to 36%. They browsed the site twice as long. They browsed 33% more pages once we had pricing available on our website compared to when we didn't. And if you don't want to take my word for it, take a look at Bradley Hubbard. He's a plastic surgeon with the Dallas Plastic Surgery Institute in Dallas. And he found that once he put pricing on his website, that 23% of the page views for his whole website were on his pricing page. He also looked at the traffic on his website, and he found that most of the traffic was first on the landing page, then the photo gallery, then the pricing page. And you may be thinking, like, why am I bragging that the pricing page was the third most trafficked page on his website? Well, when you look at the amount of time spent on his website, this completely reversed. That now, when you look at time on the page, pricing page was number one, then photo gallery, then the landing page. And my point here is that even though I don't know the Google algorithm, I do know that the amount of time somebody spends on your website is definitely a major trigger to Google. It's a signal to Google saying, okay, people are spending more time on this website. They must be finding what they're looking for. And that's what Google wants to do, is it wants to show the results on the organic search rankings of what's going to be the most useful and beneficial to the consumer. So if consumers are on your page longer, which they are with the pricing page, that's going to help your SEO. The other benefit is it helps the consumer avoid sticker shock. Again, it helps them, it helps with the conversation of them checking pricing, the conversation with the front staff, the front office staff before they come in for a consult. It helps you get down to the nitty gritty of what they really are a candidate for. So rather than coming in for a nose job, they're coming in knowing that they are getting, they're going to get a consultation for a nose job after their 15th revision. The other thing is that if you do this right, it can be the right call to action to capture contact information, generate leads, build a huge email database. And let me demonstrate what I mean by this through this graph here. With this image, with a call to action button. So if you're looking at a sales funnel and you look at the bottom of the sales funnel, which are the people that are ready to come in, those are the people that are ready to book online, have a consult. But that's not where most of your patients are. Somewhere in the middle, these are the patients that are going to submit a question through the contact submission form, which I think are lame, and I'll get to that more in a second. But also in the middle of that funnel, the people are ready to do live chat, ready to book online. But what about all these people at the upper part of the sales funnel? These are the people who are just starting their research. What's the call to action button that's going to capture their contact information? Because you can brag about all the traffic on your website, but until you're capturing those leads, finding out who those people are, there's not much you can do with that visitor to your website. You can't follow a click. you can only follow contact information. So the best way to capture everybody on your sales funnel, just from the people that are just starting the research versus the ones that are ready to pull the trigger and come in, is a get a quote now button. This is the greatest call to action button because everybody wants to know pricing. Doesn't make them a price shopper. They're just a normal human being that wants to know how much this big ticket item is going to cost them before they come in for a consultation. So the best way to offer online pricing is automation, and you can't really get that with a contact submission form because that's going to require you to have to manually respond to the consumer who's asking about pricing, which that's what everybody uses the contact submission form for. And so automation is great. A price estimator or a chat bot that captures their contact information, that's going to be a great way to do this. A static menu of pricing, you're never going to get contact information out of that. And then also, you want it to be automated so it provides them a quote immediately emailed to their inbox. You don't want to have this thing where you ask them for what procedure they're interested in and you say, okay, we'll get right back to you with a quote. People want more instant gratification than that. And as I talked about earlier, I don't think ranges are good because it gets them further away from an accurate estimate. I know that sounds like an oxymoron, but an accurate estimate is a reasonable thing. And of course, don't bait and switch and put cheap prices on your website and then bump it up when they come in. That obviously is not the right thing to do. So how do we do that? How do we generate leads? And the two things that I recommend that we use, that I use on my own website, are chatbots and price estimators. And so what I'm going to do is provide you with a demo now of one of the BuildMyBod user. It's also a Symplast user, Dr. Tim Syed in San Diego. And I'll talk a little bit more about Tim in a little bit, but I'm going to demonstrate both the examples of a chatbot and a price estimator. So here's Tim Syed's website. You can see it on your screen. And the first thing you'll notice is this chatbot down at the bottom. And now, one of the things I talked about from an SEO perspective is that there are going to be those patients who want to bounce. They're just going to leave your website as soon as they get to it. So with a chatbot, this is a better way of keeping those people who land on your website, keeping them there before they go anywhere else. And so with the chatbot, I'm going to refresh the page in case it's been stagnant for too long. But with the chatbot, they are able to really just drill down to the category or procedure they want. So they check the category, like let's say body contouring. These are all procedures specific to Dr. Syed. We'll say a tummy tuck. And then before we give them the pricing information, we ask what's their email address. And I'm going to just fill this in as though I'm the consumer, put in my email address, and the doctor can ask whatever information they want. They can ask just for email address, just for phone number, not the last name or the first name, but just as an example. And by asking for the zip code, you can actually find out if they're local, if they're a good candidate or somebody that is willing to come in soon. So then we show you this here, that the wish list has been sent to my inbox. Now, again, the point is we don't show them the price right there on the screen because we don't want them to put in a fake email address. So if I reload my inbox here, you'll see I've got an invitation from Fleming Steakhouse, but that's not the point of this. But you'll see right here in real time, I've gotten an email from Dr. Syed's office, essentially, where I can see his logo and I can see the procedure I'm interested in. I see a breakdown of the pricing. I see the cost. Dr. Syed's office gets this same exact email where they can see my phone number and my email address. And then they see again down here where I'm located. So they're in San Diego, I'm in San Francisco. Maybe I'm not going to be the first lead they should call back, but that's the benefit of price transparency and lead generation, is because consumers can check pricing and then they can actually go and find out the pricing, and your office staff gets their contact information. Now, if they want a little bit more information, they can use the price estimator. There's a very obvious call to action button right there on the screen, get a quote now. And it's kind of cool because they can scroll through and look at the different categories, or they can just search a procedure. And I know we've searched this before, but this lists all the breast procedures he offers. And so you could choose one of those, or you could just scroll down, choose the category. And he does a lot of en-bloc resections for as far as capsulectomies and things that people want to get rid of their implants. So the consumer can watch a video about this. They can add it to their wish list. And then similarly, they can, we ask them a little bit more information because it's a more fully functional price estimator where we can see how soon they're looking to get it done. It just helps stratify them a little bit more. And it's the same thing where they can do Google single sign-on, create an account, and sign in and submit a wish list. So the same thing, I'm not going to go through the whole thing again because you saw essentially what it does, but it basically allows them to submit a wish list after watching more information about this procedure on the video, looking at before and after photos, and submitting a wish list. And once we verified their account, they can see the pricing on the screen, and they can even schedule a consultation, even apply for financing. So that's what you can allow the consumer to do: check pricing and in real time, get the answer they're looking for, and you generate a lead in the process. Going back here, let's talk about something else, is that I don't want anybody to think that this only works for cosmetic services. If any of you with Symplast are also providing insurance-based services, this works for you too. In this quick video, you'll see here where you can actually upload procedures based on the insurance plans that you offer at your office. And we're going to choose United PPO because that's my insurance plan. And in this example, the consumer can choose the category, choose the procedure just like before. But instead of just capturing their contact information, because it's an insurance-based service, we can actually show them what their out-of-pocket expense is going to be. So they can, if they know the information, they can put in their deductible and their out-of-pocket maximum and their copay, but people may not know that information. The other thing is you could just let them get the negotiated rate, not necessarily knowing what their out-of-pocket expense is. But the most accurate option, and this is something they probably can do because they have their insurance card in their wallet or in their pocket, they put in their member ID, their name, their birth date, and in real time, they can see, again, they look at the insurance plan, they can see the procedure, the CPT code or DRG, they can see the estimated procedure cost, but that's not really actionable because the estimated procedure cost is probably not what they're paying. And again, look at what we're able to do. Because they put in their insurance plan information, we're able to see in real time how much can be applied to their deductible, to their out-of-pocket maximum, their copay. And so instead of them owing $63,500, they only owe $8,016 because we were able to check their eligibility in real time. So if you're an insurance-based practice, you know what I'm talking about. The consumer can now check eligibility, and you'll get an email in return with the patient's contact information, and they will see what their out-of-pocket cost is. So this is super effective at moving some of the back office processes of checking eligibility and moving it to the consumer-facing side. So huge benefit to doctors' offices that do take insurance in addition to cosmetics. So just throwing that out there. And how are we able to do this? Well, this is actually another integration we have not only with Symplast, but with TriZetto, who's also integrated with Symplast. And with that ability to check that eligibility, we're able to give the consumer their out-of-pocket responsibility specific to their insurance, specific to the procedure, and specific to the amount they've already paid towards their deductible. So this is huge. This is capability that has not existed before. So let's get into some data. You've heard me talk a lot about what we can do. Well, let's show some data. So this is from my website. I checked out my overall leads from my website through the chat bot, through the price estimator, and through the website submission form, which you already know I'm not a big fan of. And over the course of 6 months, I had almost 2,500 unique leads from just these 3 sources. This doesn't include doctor referrals, patient referrals, and things like that. This is just through my website. And you'll notice that over 2,000 came from the price estimator, almost over 450 came from the chatbot, and a little sliver, 22 came through the website submission form. And so you may say, well, you know what? I get more leads from the website submission form than 22. And you might, because you don't have something more tantalizing like a chatbot or a price estimator where consumers can check pricing. People are going to go through that website submission form to ask you how much something costs or see if they can book a consult, and you've got to manually respond. The other thing you might notice here is that I'm breaking it down between the number of leads we got and the number of consults. And you see that we got 4 consults out of 22 from the website submission form. You're thinking, oh, 18%, that's pretty good. Well, we thought that was pretty good until we looked at those 4 leads and we found out that they actually initially found us and they initially contacted us via the price estimator or the chat bot. So we almost got 0 leads, initial leads from the website submission form. So it's all about attribution. How do people get in contact with you initially? And so all of our leads really do come through the price estimator or the chat bot initially. And there's a lot of those consults come in and maybe the percentages aren't high, but the thing is, we're building over almost 2,500 leads from the price estimator and the chatbot. This is building a huge email marketing database. So website submission form requires a manual response. I'm not a big fan, but the price estimator, automated instant response, and the chatbot, it's really kind of just idiot proof and builds a huge email database. Again, if you don't want to take my word for it, let's talk to Dr. Bradley Hubbard, plastic surgeon in Dallas. He followed his price estimator leads over the course of a year and found that he got over 1,500 unique leads. And as far as the number that came in for a consult, percentage is kind of low, 7%. But this is where percentages don't really matter. He got the absolute number was 105 consults. Can you imagine? Do you have any service that you have that generates leads and you get 105 consults out of it over the course of a year? 105 is amazing. 80% of those progress to surgery within 6 months. And so if I ask you, do you have anything that provides you 105 consults over the course of the year from one lead source? Well, this is the next question. Do any of them provide that to you for $12.50 per unique lead? So the cost per lead is an astonishing low, $12.50. Most people will tell you a lead costs over $100. And getting back to my previous point, this is a great way to build a huge email database. His price estimator leads account for 75% of his email newsletter database. And that's a way you can really build your practice with a robust email database. Because if you get the right demographic of people submitting wish lists to check pricing, this demographic is better than what Facebook can offer or Google AdWords. Certainly less building a huge email database and sending out emails like 12, monthly email newsletter is way less expensive than all of this advertising. And I've built an email database of over 14,000 active email addresses. And so look at this example of if you're wanting to advertise on Facebook, you don't advertise to the 2 billion people on Facebook, you narrow it down. I did 10-mile radius around San Francisco. And even though Facebook has so much data, they can't actually tell you that somebody's interested in cosmetic surgery. They'll tell you approximately that they're interested in shopping in fashion and women's health. And sure, there's some overlap there in a Venn diagram between those interests and cosmetic surgery, but it's not exact. And if you're paying that amount of money for Facebook advertising, you want to do better than just approximately advertising to the right demographic. And you can see at the bottom, the estimated people I'd reach was 3,600 to 9,600. Well, I just told you I've got over 14,000 email addresses of people I know are interested in cosmetic services that I offer because they were checking the pricing. So it's way less expensive, and you can own your marketing in the process by building a huge email database, not having to rely on all those other services. Want to quickly point out that we did do a research paper on this. We measured our data the first year I was here in practice in San Francisco. And we found, and this is open source, anybody, you can Google it, price transparency in the online age, you can read it. And what we found is that people that were coming in that were price aware were 41% more likely to book a procedure than non-price aware patients. So highly effective at moving patients from the exam room to your procedure room. Also, if we're talking about data, this is something that's pretty cool. This is only for the provider's view. This is not for the consumer. But when you upload your pricing to our database so that it shows up on your price estimator, that when you upload those procedures and those prices, you can actually see how your prices compare. This is a doctor in Southern California uploaded the pricing for a tummy tuck. They're able to see in real time how their prices compare across the US, region, state, 15-mile radius, and zip code. So really gives you an idea of how you fit within the competitive landscape. And so now I want to talk about our integration with Symplast with Dr. Tim Syed, who I showed you his website before. I submitted a couple wish lists through his website. He's a plastic surgeon in San Diego and Newport Beach. He's both a user of Symplast and BuildMyBod. And we did a quick little study on his website. We collected data from that integration from May 1st to June 22nd, so just a little under 2 months. And a special thanks to Christine for her help with the data collection. But what we found is that over that less than 2 months, that he collected 86 leads from just the BuildMyBod source. And if you look at the pie chart, you can see that as of right now, 14 consults have already scheduled in that short time period. And of those 14 consults, some of who haven't actually come in yet, 5 procedures have already been booked. So that's 16% of his leads have already scheduled a consultation. And at this point, 35.71% have already led to surgery so far. And I know for a fact that some of those consults aren't scheduled until later in July or August. And those people theoretically could also book surgery. So for having just a price estimator on his website and generating 86 leads and getting that many people to already book surgery is pretty significant. And just as I shared with you, Dr. Hubbard's cost per lead, when we prorated the cost per lead with Dr. Syed over 2 months or just under 2 months, it came out to $3.47. So I challenge you to find a lead source potential that for a cost per lead of that little. So pretty amazing. The other thing people will ask, and it's a legitimate question, this is one of the reasons we wanted to do the study, is that we wanted to look at, the price that people got on the wish list, the estimated cost, versus how much they actually spent once they came in. This actually goes back to Isaac's question. Once they come in and they talk to the doctor and they do the consultation, are they really a candidate for that procedure that they chose themselves? And what we found is that when you compare the difference between the estimated price that they got with the wish list versus the amount they actually paid for the surgery, it was a difference of 10.62%. So if you're talking about an $8,000 operation, it's about a difference of $800. Definitely not the most ridiculous difference. It's not like we're talking about they check pricing for 15,000 and the operation was 30,000. It's not like that. It's just not it's just not the case. So going back to our discussion about dogma, it's not too hard to show pricing on your website. It really does contradict the fact that online estimates, or that people considered online estimates just too inaccurate. So not true. It is accurate enough to get a good qualified lead into your practice. So at this point, I'm going to turn it back over to Isaac, and he's going to take it away with to discuss medical PRM.
I'm sorry. Thank you so much for the presentation so far. I tried to interrupt minimum as possible, but I really wanted to add two things. One is, if anybody in the attendees has any question, please, it's open discussion. Put your questions now, and at the end of this webinar, we're going to stop and answer any question and address all of it. If your mind didn't blow from what you've seen right now in the data you heard, it's because you don't know the data. That is really is. And that's really what we're going to touch right now. So medical PRM, it's a tool to really manage your leads. I'm going to show a live demo. I'm going to use our demo account. I'm not going to interfere with the privacy of different leads that Dr Syed and now Dr. Kaplan is going to be probably on his account as well. Medical PRM is really here to help you to gather all those leads from the different lead source. And obviously one of the main lead sources is going to be BuildMyBod, but of course, you're also going to have your forum on the website, and you're going to have different forums on different social medias, and you're going to use Google to attract them to different landing pages. A smart man that I used to work once said, when you need leads and you compare it to fish, how would you go fish? Would you use a rod? Would you use a spear gun, or you spread a net? And the right answer was all. So when it comes to leads, you really want to try a little bit from everything, and then you want to measure. You measure and you see what works more, and that's where you put more effort, and the things that works less or not make it worth it with such a low cost per lead, then you just drop those. So once a lead coming into your system, this is really a bucket. Think about it like a bucket that all the leads in their funnels coming first to that, and they're going to start as a new not contacted leads. So you know that this lead was generated. The system have the capability also to trigger texts and email for every new lead that is been added into the system, and start to connect it into a different data points. So we see that Kaylee Jenner is not contacted yet. Of course, somebody from the practice should reach out to her. I'm going to pick on Joe Jonas over here. We see that it's a warm lead, which means somebody already tried to contact them, probably more than one time at this point. And I'll assume that was not able to get an answer, or was able to get an answer that lowered the temperature of this lead. So when we click on manage the lead, we can gather a lot more demographic information with what's the gender, what's their birth date, and we can change their different status. The status really reflect your practice workflow. So it depends on your practice stages of what you have. Of course, it's always start from not contacted, right? Because nobody reached out, but the moment you touch it, it's starting moving into attempting to contact, then it works into working. Many times it will need to move into the PCC to have another conversation before the appointment to the consult will take place. Then they will schedule the appointment to the EMR, and the outcomes can really be either you won this patient and he became a patient, or it's lost because it was not qualified, right? Sometimes you're getting all those leads that just try to sell you something, or are not relevant, or not familiar with the price, and then they have price shock and it wasn't the right fit anymore, or they just decided it's not for them at the end, or whatever reason, so it was not converted. And of course, there is also medical disqualification, right? If their BMI is too high, or been smoker for 90 years or so. At that point, once you made a contact, of course, you have drop downs that you can choose different stage of what this really the sub reason or the status reason You can modify the different rates that influence the different colors on the management screen that will help people to understand. And then you also have the different follow-up days. So it means, when is the next time I need to call this person? A lot of people don't know that really only 20% of the people that call your practice schedule the appointment in the first interaction. It actually takes between 5 to 7 follow-ups to take somebody who didn't schedule the first time into a booked consult in your practice. And keeping on those 5 to 7 times is not going to happen with sticky notes, not going to happen with Excel. You really need a good system that you can change the date, that everybody can be aware, it can sit in the cloud, the information is shared. So if somebody didn't came today in the morning to the front desk, somebody else can do the follow-ups for them and provide all the information and educate those leads will help you close them faster. And of course, tools like BuildMyBod that can already give them the price and already educate them with different videos about the procedures, take it so much farther. I'll suspect that somebody that comes from BuildMyBod and didn't schedule in the first time, probably only going to take 2 or 3 times. But if it's not like that, then you need to be the one educating the leads and answer all the questions, and then they go and they speak to their friends and come back to you. So you'll need to follow up on them again. Most important from a marketing point of view is really gathering all the information of the initial service of interest that always going to have a revenue associated with it, the marketing channel, and the main lead source and sub-lead source. So you'll know how narrow you can go in. Just like we saw in the charts that Dr. Kaplan presented, in the website, it was either a form, it was either the price estimator or the chat. It makes a huge difference. People don't aware of it, but website is not just website, right? The page that they fall on, that's the page that they feel the most trusty. I've seen websites that have form on every page. It's an overkill, but if it works, right? And that's really where we need to gather all the data so we will know what works and what's not. And the last and not least, of course, it's to collect the campaign that is associated. So if you have a sponsored marketing effort, you want to connect it into a campaign. Campaign holds the cost of that marketing initiative. So later you'll be able to analyze what is your cost per lead and what is your ROI, and of course the conversion rate. So right before I'm going to go into the dashboard, and I'm going to try to keep it short because I want to have enough time for questions, and I see some questions already coming in. This is the follow-up calendar. It's very simple for your practice patient coordinator or front desk or providers, depends who do the different follow-ups, come in, filter their names, whoever it is that needs to contact their people, and they can see them by the days, and they can just click on them, add an activity. I talk to them, I will follow up again tomorrow. I'll show example. Just by add activity, I can click on that person. Activities can be predefined, right? So maybe I use the phone to call them, and I called and I left a voicemail. If I have another note that I need to add another note, and I can already set another follow-up for 3 days from now. I hit submit, and the lead will move, turns green, so I'll know that I actually touched this lead already, so the next person not going to need to touch it anymore, and it's going to have another scheduled time to follow up in 3 days from now. So no leads will stay unfollowed. So all this money that you spend on leads, and in the example, and I was mind blown when he showed $3 per lead. Numbers I'm familiar also from the Atlas KPI days. I've seen practices spending close to $500 per lead. It sounds insane, but there is areas with such a competition of the market so saturated, like Beverly Hills or New York areas or Miami, that have so many practices in the same area, and all of them paying to Google, and Google put you up if you pay the most. He gets to hundreds of dollars just to get to somebody to click on you, and it's not guaranteed that they're going to give you the information. So I've seen it all. This tool comes, of course, with different dashboards. I'm going to touch the marketing dashboard here. I think it's one of the most important one. I'm going to change it to all time because it's a demo account. And just for you to understand, the information that you're going to be able to get by working through this lead is not just, of course, the make sure that all the leads are being maximized all the way to the end, whether you win or lose that information that you got. But then you can see also all the prospects that actually schedule the appointment and schedule the consult in a conversion rate percentage. Then you can see from the ones that did schedule, how many out of them actually became a patient. So your surgical conversion rate or your practice conversion rate. You'll be able to see your marketing potential ROI, which is based on the initial service that the lead picked when he was interested to hear more from you. And then you can also see the actual ROI. So once they become a patient, you can add, he actually asked for a facelift, but he ended up with eyebrow lift that maybe was cheaper, and that reduced the marketing ROI, of course, and the cost per lead that it will be very easy for you to analyze. In addition to that, you'll be able to see all the conversion based on the different lead source, where people are coming, marketing channels, and a lot more than that, all the way to who is the employees that work the best, what works, what's not working, what makes you not to convert, because once you collect the data from the upfront, it's very easy to analyze it all the way to the end to be able to do the conclusion of, I want to put more money here, I want to stop to put money on that, and go back to your marketing agencies. And I know that 90% of the practice is using it, and it's great, but they end up just sitting in a quarterly meeting with them, going over 14 pages of PDF that talk with them about bounce rates and sessions on the website and things that no business owner should ever care about. Really, all they need to care about is, how many leads did you generate to me? How much did I pay for each one of those leads? How many out of them I made money from? That is really the bottom line of all the marketing efforts. So all this information and the system built in a way that you can also share it with your marketing agency, it's HIPAA compliant, and you sign them on BAA, you give them access, but they don't get that access to before and after photos or how much money your practice really makes. They really get information about the leads that they generate, and they will be able to say for you what works and not working. So then your discussions once a quarter or once a month that you should meet with them, really turning into a lot more data-driven decisions. They can present to you, they are a lot more aware, there is no mystery for them. I generated for you 100 leads on your website, you need to tell me which one of them converted, right? And then become to be your job, and nobody really do it accurately unless they use a good system to do it, just like Medical PRM, for example. So I'll go back into the presentation, and my next slide, I just want to make sure you guys can see my slides, yeah? My next slide, of course, is going to be Tim Syed. Dr. Tim Syed is a great customer of Symplast, great advocate, and great customer for BuildMyBod. So I wanted to take that moment just to say thank you and appreciation for letting us use his account, his name, of course, a very respected doctor in the US, and the data that he was able to provide to us in order to show this proof of concept of all those systems together and really how we can benefit every practice. Dr. Kaplan, I'm going to pass it to you again to just go over really quick the conclusions, and then we can touch a little bit the.
Yeah, just like I was right before I pass it off to you, the main thing I wanted to get across to people who think that online estimates just can't be accurate enough. They really are. We have the data to support it now. Secondly, by using a price estimator or a chatbot on your website, it's very effective at generating a large number of leads at a very low cost per lead. And because you're generating all these leads, the third point is that it is great at building a huge email database. You can't build an email database on 22 leads I was getting from my contact submission form, but you can build it from the 2,500 leads I was getting from the price estimator and the chatbot. That way you can own your marketing. And just by them being on your website longer, you really will be able to improve your SEO. Those are the main three take-home points I wanted to convey to the audience tonight.
Awesome. And well, plays those again.
And
you want to offer a special offer for the people who are watching it
absolutely,
today?
Absolutely. So if you head on over to take a screenshot of this or take a picture with your phone so it doesn't go away too quickly, but you can go sign up at buildmybod.com/sign up. We make it easier, make it easy for anything that you want to do, whether you want to just start with a month or whether you want to sign up for a whole year. If you want to do a month, you can do a 1 month free trial of our price estimator with 1 month free with the promo code. And if you want to commit to the annual subscription for a very low price of $1,500, and then you can apply the 10% off annual subscription with promo code MRN. So it's going from $1,500 to $1,350 for the year. You just type in MRN with the promo code. For a big shout out to Med Results Network. That's a promo code we're doing in conjunction with them. And you will be asked to enter your credit card information along with the promo codes. But you won't be charged initially for the free month trial. But if you want to do the annual, you'll be charged and get that 10% off, like I was saying. Anyway, if you do the month at a time, if you want to continue after that first free month, We will add the chatbot to the price estimator at no additional charge. If you do sign up for the whole year, you'll get both the price estimator and the chatbot added to your website. And we can make this go live within 24 hours. This is not a long, drawn out process. You upload your procedures and prices. We send you a line of code for your web developer and they can embed it into your website. We've literally had doctors go live from beginning to end within 24 hours. It's really very easy.
Wow, that's amazing. It's actually going to be one of my questions later. How about that? Again, place it again, I guess. We also have a special offer for the people that watch and we're interested in Medical PRM. If your phone is already up from taking the photo before, take the photo again. Go to symplast.com, just /request a call, fill up the form, our team will contact you. Make sure you tell them that you watch this webinar and you would like to try Medical PRM without any obligation, no commitments, no credit cards, no contracts. Again, can also be set up fairly quickly within a week or two. You can have all your accounts already been connected. You can start to measure all the different lead sources that you get, see what works, what's not working. After 2 months, you feel that it works for you, keep on, renew, and get into subscription. You don't even have to be a Symplast customer to use Medical PRM. So you can use it in conjunction with BuildMyBod and keep it right there and continue to use whatever EHR you use and enjoy the tool, but maximize all your leads that coming in. I'll start here, 1, 2, 3, 4. All right, then I'll leave it on this screen. So of course, everybody can feel very free to reach out directly either to myself or Dr. Kaplan with any other questions or by phone, email, of course, if you would like to get more information about anything that we discussed today. But I also would like to open it up for questions from the attendees. We have a couple of minutes left, so let's start to use it. I have a couple of questions of my own, but I've seen already that we received few of them. So I guess the first one, here we go. The first one was actually one of the questions that I asked. I think first question was if they can show a range rather than the exact estimates. And I think you already addressed that very well at the very beginning. So.
All right. Yeah. I mean, just to quickly reiterate it, is just that instead of showing a range of prices, show a range of procedures, and then they can choose the procedure they think fits the best. And then when you follow up, because you've got their contact information, when your front office staff follows up, you can really drill down into the right procedure before they come in for the consult. Makes it it's a much easier discussion that way.
There is another question here is what I am supposed to do with all the email addresses, all the emails that they collect.
Yeah, I mean, it's a lot of email addresses because what you're doing is most call to action buttons aren't this tantalizing, and they aren't. And because like if you ask somebody like, oh, give us your contact information, you can sign up for our free email newsletter, or give us your contact information and we'll send you a free ebook. That might generate some leads, but it's not that tantalizing. How much does it cost is a very tantalizing question. And when you promise that to somebody, you're going to get a lot of leads. So you can't expect that all of them are going to come in. But keep in mind that the people who are checking pricing on your website, those are people that are interested in your services. If they don't get it from you, they're going to get it from somebody. And so you want to take all these email addresses seriously, add them in your email marketing database, and each month send out an email newsletter. And each day, your email database is going to grow more and more passively each day with each person checking pricing. And eventually those people are going to come in. They're going to be interested in the service they want, and they're not going to have sticker shock. So just keep passively adding them to your email marketing database, send out an email newsletter once a month. And that's 12 additional touch points, because people always quote like you have to touch people 7 times before they come in or before they book. Well, touch them 12 months. Of course, I'm speaking touch them figuratively in this day and age, but touch them 12 times throughout the year with an email marketing with an e-blast. And that's what you do with those email addresses.
Right. I see here a question, and I'm even going to take it a little bit more difficult. So I'm familiar when patients are scheduled appointments, and I mentioned it a little bit in Medical PRM, and they schedule the wrong appointment. They schedule the wrong interest that they have, right? They think they need a facelift, but they actually just need a mini facelift, or like you mentioned before, with the different implants that they can pick, right? And it seems like there is some dependency on them to really know what is the procedure and all the specifics in order for them to get the right price. How would you suggest to practices to handle that? Because I'm sure it's a concern, just like you said, if there is 5 different implants and there is such a big range of different prices, should I just put the cheapest and keep it vague?
Right.
And then when they come, I'll have the
Well,
conversation?
I think the first thing to remember is remember that nobody is seeing a price until they put their contact information in. So even if they choose the wrong procedure, you still get their contact information. And that's really the most important thing at that point, because then you can follow up with them and then you can have the conversation and make sure you get them on the right track. But a perfect example, one of Dr. Syed's patients, when I talked about how it was a difference of 10% between what they chose on the wish list versus what they actually paid, 10% difference. It was a person who wanted an en bloc resection of their capsule and remove the implant and everything. They were done with their implant. And they chose that. And then when they came in, they needed to remove the implant and the capsule and get a lift. And that accounted for a little bit of the difference. So no, it's possible that the patient's not going to know exactly what they need, or one of the patients also needed some fat grafting after they had their implants taken out. So the patient's not going to always know, and they may not choose the right procedure. But it's not like we're saying they're going from checking pricing to all of a sudden being in the consultation room with the doctor. Like, and that's, they think they're coming in there thinking that's the right procedure, because you're going to call them up to schedule the consultation, and your front office staff, I'm sure they're well trained to talk to the patient. They're going to find out over that phone call after they've captured their contact information, what's the right thing for them, so that by the time they get to the consult, there's going to be much better appreciation for what they need and their expectations. Because that's the other thing, is once you have that conversation over the phone when they're booking the consult and you find out what maybe is more appropriate for them, you can use the chatbot. The front office staff can submit a wish list through the chatbot while you're on the phone with the patient saying, oh, you don't need a breast aug. You need a breast aug with a lift because you've had so many kids and so much breastfeeding. I'm going to send you the estimate through the chatbot on the website now. And so while they're on the phone, they get the updated estimate. And so then they're even more prepared for their consultation. That's the beauty of this, is the front office staff. It's not just for the patient to check pricing through the chatbot. The office staff can submit a wish list for them on their behalf through the chatbot while they're on the phone with them. So it's a really great way to have a very robust conversation before they even make it in for the consultation.
Absolutely. That's great. I'm familiar because I've seen many practice consultants who consulting, especially on insurance cases, and how to choose the right codes and the right things in order to get the best, I guess, coverage by the insurance. And with the price estimators on the website, we are also again relying on the patient somehow to choose the right CPT codes or the procedure with connected to the right CPT code in order to really adjust the price so they will pay the minimum. It's similar, I know, to the question that I asked before, but that's more
Yeah.
specific to insurance, that I've seen a lot of practices internally struggling to pick the right CPT codes. So
Yeah.
would that
So
also ease to the practice
yeah.
themselves to use it?
So the practice should only put up the CPT codes that they want to accept. And so a lot of times the patients actually are starting to know the CPT code ahead of time. I'm not saying that's like generalized that everybody knows the CPT code, but they're more sophisticated than they used to be. So only post the procedures and CPT codes that you want to offer. And when the consumer comes to the price estimator, if you're offering insurance-based procedures, a perfect example is a breast reconstruction with like a DIEP flap. And the consumer knows they want a DIEP flap, have that procedure listed on your price estimator. They choose that, they put in their insurance information. And instead of the back office staff doing the eligibility to find out how much they've paid towards their deductible, the consumer can find out from a consumer facing perspective on the price estimator. And that information is sent to the office staff. So now the office staff knows the patient's interested in a DIEP flap. They chose the insurance plan. They know how much they've spent towards their deductible, how much they're going to owe. And so a lot of times what doctors are doing now is they're treating it kind of like a cosmetic procedure, in that when they come in for a consultation, they're like, okay, you are a candidate for this. This is what you've paid towards your deductible. This is how much it's going to cost. This is your out-of-pocket responsibility. You have to pay that now before we do the operation. And if there's any difference after the fact, then we'll reimburse you a little bit. That's not new to Build My Bod Health. That's what doctors' practices are doing now for insurance-based services. They're getting what they suspect the payment will be, what the out-of-pocket responsibility will be ahead of time once they come in for the consultation. And so what we're doing is we're helping them get that information before they even come in for the consultation, so that by the time they come in, have the consult, that is the procedure, then the consumer's already prepared for what their out-of-pocket responsibility is for. So it's pretty awesome from an insurance perspective, because you're offloading so much of the back office work to the front end for the consumer to figure out. and then the doctor's office can use that information from an eligibility perspective. Now, for those of you who are listening that only do cosmetics, maybe none of this makes any sense to you. Maybe in a former life when you did reconstruction, that makes more sense. But I'm just telling you that even though we're all worried about cosmetics here mostly, that the insurance is obviously a bigger element to the entire healthcare world. And I know that this can ring true with a lot of the attendees today, that you can really make your life easier from an insurance perspective also.
Right. No, and I can say, if I was a doctor, I would run a practice and I had this tool, I would advertise that they can see prices on my website.
You know,
I think
you make a great point,
really give
Isaac.
advantage.
Just from you, just the idea of you advertising that you share pricing, like whatever advertising you do, if you just mention that you have pricing available on your website, that's going to drive even more traffic to your website. That, because just that tantalizing little carrot, people want to know that, and they will. That'll increase your traffic for sure, and then you'll find out who they are.
So unless another question going to come while I'm thanking everyone, we came to the end of it. So I really appreciate everyone's time. I really thank you, Dr. Kaplan. It was a pleasure, and it was great having this discussion with you, learning more about BuildMyBod. I see that just now another question came in. So how long does it take to upload all my procedures and prices? And how long does it take to insert the price estimator or chatbot to go live on my website?
Yeah, absolutely. So whenever you go to sign up, you'll be able to create an account instantly right there on the website. That link I gave you, buildmybod.com/sign-up. You go there, you can create an account. You don't have to wait for us to create the account for you. You log in, you put in your name. You can start to choose procedures from our default list of procedures. You can start to put in your pricing. At that point, you don't even have to put in a credit card. You can actually start uploading procedures and prices and see how your prices compare in real time, like I was talking about. So you can upload at least 10 procedures. Then you're automatically going to get an email saying that, you know, you subscribe, choose a plan of one of the ones I talked about. You're going to get an email with a link that you forward to your web developer. It's one line of code they embed into your website, and you're live. It's really that easy. You can, I mean, theoretically, you could start uploading your procedures tonight because you can create the account. You don't have to wait for us for that.
That's awesome. That's great to know. Yeah, Medical PRM, same concept. They get an embedded leads link. They put it on the website. They get the form, and it's do all the rest of the tracking pretty much for them.
And then that, of course, we can connect that link so that all the leads coming from BuildMyBod will go straight into their Medical PRM account. Exactly right.
Awesome. All right, Dr. Kaplan, thank you so much. Thank you, everybody.
My pleasure. Thanks for having me.
That was our pleasure. As always, hopefully we're going to do another one time soon. Thank you, everyone. If you have any question, again, this is our emails. Feel free to shoot an email, to give a call, or go to the website to sign up, get advantage on the discounts. Have a good night, everyone.
Thanks so much.
Thank you.